There we go. We've got that recording now so that we can post this online, and any other folks who aren't able to join this meeting are able to review this later. So again, welcome to our Q3 Maternal and Child Health Action Team meeting. Wanted to start with just a little bit of kind of reminders for this team and some ground rules so that we can all be approaching each other on kind of a level playing field here. We want to all keep in mind that we want to step up and step back while we're listening to everyone else in the room. We want to respect everyone's time and expertise. 90 minutes is both very long and very short. We want to elevate the expertise of lived experiences, particularly in the realm of pregnancy, giving birth, infant care, family care. There are a lot of real sensitive topics there. We want to support everyone's learning processes, so please feel free on my end, raise your hand, pop off mute, whatever it needs to be, ask your questions, put it in the chat, however we can make sure that everyone's getting what they need. Be ready to listen with the goal of understanding and supporting each other in this work. And then remembering our North Star as the health department, as this team, is the health of all people and neighborhoods in Milwaukee. And here is just our brief agenda, which we will try to make sure we go through a little bit quick, just since we got a little bit of a late start. We're going to have our welcome and introductions. We're going to have a presentation on some of the racism and health equity topics that are a part of the steering committee. We are going to discuss our co-chairs. We are going to look at the strategies we have identified and work on kind of prioritizing and generating a timeline, and then we'll wrap up. So again, today's meeting, we want to introduce the overarching elements of the MKE Elevate, which is to address racism and bring health equity to the city. And we're going to go through our co-chaired candidates, not voting yet. This is to introduce those candidates. And then we're going to discuss implementing our identified strategies. So for our introductions, there are fewer of us here than last time, but I still want to make sure we keep it kind of quick. So we're going to do a nice brief, introduce your name, the organization you're here representing, and then one quick thing you're looking forward to when fall arrives. We're going to start here in the room, going around the table, and then we're going to hop over to the Zoom, and you guys on the Zoom are going to popcorn. So you're going to call on the next person after you. So I'll go first. My name is Melissa Seidel. I'm a health strategist with the Milwaukee Health Department, leading this action team. And one thing for the fall is those crisp days. And if you want to maybe stop sharing the screen for now, just so we can all see each other. You're welcome to come off of video, but you don't have to when we get to the Zoom. So I'm going to pass it to Mary right over here.
Okay, my name is Diane Williams. I'm a data and evaluation coordinator with the data team. One thing that I'm looking forward to in fall is apple orchards.
Hello everyone, my name is Savani Munch, meteorologist with the data team at the health department, and I'm looking forward to the Packer games.
Hi, my name is Christina Beeling. I'm the program coordinator with the Bomb Doula program at the health department, and I'm looking forward to passing out trick-or-treat candy.
Dorian James with the Advent Safe Homes program for the Department of Health Services, and as you got me football, all is football, so.
Melissa Babler, Sexual and Reproductive Health Manager with the Health Department. I'm going to say sweater weather.
I am Christy Anderson. I'm a Population Health Service Fellow placed here at the Milwaukee Health Department. I'm looking forward to Thanksgiving.
Nice. All right, so I will pop it online to Cameron, who is my other helper on these meetings. Go ahead.
Hi, everybody. My name is Cameron. I'm a home visitor with the Milwaukee Health Department in the EFM program. And I will say I'm looking forward to just the leaves changing.
And call on the next person.
I'll go ahead and pass it to Tracy.
Hey everyone, I'm Tracy Stanislawski. I work for Vision Forward Association in Milwaukee. We work with children and adults who are visually impaired. And what I'm looking forward most to in the fall is the crisp air, and I love taking walks in the leaves, so that's one of my favorite things. And I will pass it on to Allie.
Hi, everyone. My name is Allie Tuller-Reed. I am the Compliance Officer and Interim Data and Evaluation Director for the Milwaukee Health Department. And the one thing I'm looking forward to this fall is hockey. I'm a huge ice hockey fan. Oh, and I'll pop it over to Annika.
Hey everybody, I'm Annika Moore. I'm a public health strategist with the health department. So work with Melissa and then also with Alex to kind of co-lead the community health improvement process. And I'm looking forward to the leaves, specifically in Humboldt Park and just sitting in them with my dog. And I will pass it to Samaya.
Good afternoon, everyone. Samaya Clark, the Director of Systems Integration with Milwaukee County Department of Health and Human Services. And this fall, my two oldest children are both starting college. So quiet house, maybe clean, like no dishes in the sink. I'm looking forward to that. And I will pass it over to Lakita.
Hi, everyone. Lakita Watts, Executive Director with Essentially Empowered Inc. and co-owner, co-manager at TLC Community Health. And I am so not looking forward to the fall. I am a summer girl and I'm just so sad that it's ending. But I guess if I had to truly pick something, just trying out more food, I guess. And I'll pass it to Teresina.
Hello, everyone. Teresina Simmons of Regal Aspire LLC, Regal Family Services Incorporated, and co-manager of TLC Community Health. I guess for me, I'm looking forward to taking my kids to like the apple farms and pumpkin patches. Something we definitely look forward to. Also, blankets and hot chocolate. And I'm not sure if Claire went.
Yeah, sure. Hi, everyone. My name's Claire. I'm with the Wisconsin Women's Health Foundation. And I'm excited for all things apple. I'm a huge apple lover. I love all things flavored apple, scent apple, everything. So I'm excited to bring out those candles again and eat some apple flavored things. And I will pass it to Bailey.
Hi, good afternoon, everybody. My name is Bailey Huffman, resource broker, program manager for Mom's Mental Health Initiative, which I'll throw that in the chat. We're a nonprofit organization that really primarily focuses on perinatal mood and anxiety disorders. And most looking forward to, we have a house that's extremely active we moved here last year. And the day we moved was Halloween, and we learned that our house is incredibly active with the trick-or-treaters. So we are looking forward to being better prepared this year and buying probably like 2,000 pieces of candy and getting ready for those trick-or-treaters. Sorry, I always forget to do that. Let me see who hasn't gone. I don't think Christina's gone.
Hi, I'm Christine Alstrup. I work at Maida House. We do substance use disorder treatment for women and one of our specialties is pregnant and postpartum women. I'm echoing a couple of things that I heard on already, sweater weather and apples. And I'll pass it to Perez.
Hi guys, my name is Ferris Rizek. I'm a community health epidemiologist here at the City of Milwaukee Health Department. My two favorite holidays is Thanksgiving and Halloween, so I'm excited for that. And I'll pass it to Marcus.
I think Marcus put his in the chat. He's not able to talk.
I will pass it to Kong.
Hey Frost. Hello everyone, my name is Kong Zhang. I'm with the City of Milwaukee Health Department as a data and evaluation coordinator. I'm looking forward to the NFL season and fall camping. and I will pass it over to Mallory.
Hi, everyone. My name is Mallory. I'm on the data and evaluation team with the health department, and I'm most looking forward to fall weather. When Lakita was giving the update, I could not relate. I have the opposite experience, so I don't really like summer as much, and fall is my favorite season for the weather specifically. So that's what I'm looking forward to. I don't know who else hasn't gone yet.
There's a few.
I haven't gone. I can go. Katie Murphy. I'm a registered dietitian by trade. I work at 16th Street Community Health Center as a federally qualified health center on the south side of Milwaukee. And I am looking forward to taking a trip to Sonoma and doing some wine tasting for my husband and I's 10-year anniversary. Psyched for that. I know we are struggling because Brittany, did you go yet? Okay, we're on the same page.
Thanks. Yep. Thanks. So I'm Brittany Roberson. I am the Community Engagement Program Coordinator here for Freighter in the Medical College of Wisconsin Health Network. What I'm looking forward to about fall, with whoever said like they are sad about it, I'm really mourning like summer is going. Like for like a week now, I've been sad because I know it's coming to an end. But the things that I really love about fall is Halloween, because I think it's so cool to see people dressed up in their little costumes, especially if they make them themselves. And then the second thing is like bonfires, because I feel like it's the perfect time to sit out. You don't get too hot, you don't get too cold. So those are my two favorite things.
And Crystal, have you gone yet?
I have not, so I can go next. I'm Crystal Landeros. I'm the coordinator of community health. I work with Aurora Healthcare within our community health department. So we represent public health from within the healthcare organization. I have a few things that are my favorites for the fall. So first, I like to bake treats using stuff out of my garden. I like to make soups also using stuff out of my garden. And I actually have a new fire pit this year, so I'm looking forward to bonfires.
And then Nicole, if you're available, I think you're our last Zoom person.
Yeah, thank you. My name is Nicole Logan. I work with the Wisconsin Association for Perinatal Care and specifically with the statewide perinatal quality collaborative. So we work with birthing hospitals on improving the care for pregnant and postpartum people with substance use disorder right now. And there's a lot of Milwaukee area hospitals that we are working with. And I'm most looking forward to cooler weather for my dog because he gets so hot in the summer.
And we had two more join us in person. We're just doing some quick intros, your name, your organization, one thing you're looking forward to for fall. Remember, here's our microphone.
Okay. So I am Christina Drain. I am the program manager for the Birth Outcomes Made Better Bond Doula program here at the City of Milwaukee Health Department. What I'm looking forward to in the fall. And I'm one of those people that got one of those like 12-foot tall skeletons. So I'm excited to put that out of my front yard with the fog machine and that whole setup. That's what I'm looking forward to.
Good afternoon, everyone. Josie Veal, MATC Public Health Officer. And I'm most looking forward to outside and the change in colors and leaves falling. So that's what I'm looking forward to.
Wonderful. And did we have one more? Lori, it looks like you joined if you wanted to do just a quick introduction for yourself.
Lori Dis, Director of Women's Services at Freighter Hospital. And I'm not looking forward to anything about fall.
You're not alone, Lori. Don't worry. There's a couple folks. Don't worry. It's only mid-August. We've still got summer. This was more to get us thinking down that road if we want to. Thank you so much, everyone. If you want to get our PowerPoint going again, I should be able to remember where we're at right now, but I do need those slides sometimes. So next one, I am going to let my colleague Annika pop in right now and give us the MKE Elevate brief on our racism and health equity work.
All right, thanks, Melissa. So I think as I shared, Alex Cohen and I are co-leading this process, and we work with our steering committee to help guide the overarching priority of racism and health equity. And so at our July steering committee meeting, they came up with some goals and strategies that we want to share, but we also just kind of want to share the overall approach that we have. So we know that back in 2019, both the city and I believe the county declared racism a public health crisis. And we look to Dr. Kamara Jones to help us with understanding the definition and the framing. So she defines racism as a system of structuring opportunity and assigning value based on the social interpretation of how somebody looks that can either unfairly advantage or disadvantage some individuals. And it also saps the strength of the whole society through waste of human resources. So this is sort of our baseline understanding of it, and our commitment is spurred in part by the declaration that it is a public health crisis. Next slide. So we know that we do have many health disparities when we look at our health outcomes. So Ferris helped us with our community health assessment, or the CHAW, which pointed out 4 key indicators in particular. So we know that infant mortality, childhood lead poisoning, syphilis, as well as gun violence are all especially impacting the Black community in Milwaukee. But we know this isn't just due to behavior. It really stems from systemic racism, which structures opportunity differently, offers a differential access to resources, which also leads to differential exposure to health harming experiences. And then that can actually change biology within people. So we know in particular with infant mortality, there's increases in cortisol levels, which can actually be tied back to chronic stress due to living in a racist society. So this is just our framework for how we are understanding it. Next slide. So we took kind of this updated understanding of equity and racism to our steering committee to help update the vision and mission for MKE Elevate. The previous vision was really short and simple. It was just safe and healthy neighborhoods. And while we definitely want to have safe and healthy neighborhoods, we wanted to add a little bit more to that. And so the updated vision is a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. And then the mission takes it a step further. So we want people to be thriving in safe, healthy, and equitable neighborhoods, but also neighborhoods that are free from oppression. We do this by aligning strategies and building power, partnerships, access to resources, and opportunities for collective advocacy in our 3 community identified priority areas. Next slide. So some of the ways that we have incorporated this into our work, we have been pretty strategic about how we selected our steering committee. So when we had sort of the application process, we had people say specifically how they are committed to addressing racism, both personally and professionally. I believe we had a similar question in the co-chair interest form. We've been doing some work internally at the health department. So we've had what's called a deep dive dialogue series for people to come together to sort of unpack, how do we talk about racism? What does it look like? And then we got to a point where we were able to actually look at some health department policies and use a racial equity lens to look at that. And then finally, we are developing shared language. So if you go to the next slide, we think shared language is really important, just to make sure that we're all starting from the same place, that we're really grounded in the similar concepts, which can help us achieve similar goals. It also can help to promote participation, help with collaboration, and helps just to build that trust and that unity across both the action teams and community-wide. Next slide. All right, so these are the terms that have helped to inform our updated vision and mission, as well as some of our action team work. So I'm just going to attempt to quickly help define some of the terms. So first we have anti-racism. which is an active process of identifying and eliminating racism at the individual, organizational, institutional, and cultural levels. This is done by changing systems, structures, policies, practices, and attitudes so that power is redistributed and shared equitably. It's not an endpoint, but an approach. So it provides a useful frame for an organizational change process. So this comes from Ibram Kendi's book, How to Be Anti-Racist. Next, in our report, we use the term BIPOC. This stands for Black, Indigenous, and People of Color. It's specific to the United States and is intended to center the experiences of Black and Indigenous groups and show solidarity between communities of color. Next, we have equity. Equity we define as just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. Because we have healthy food access as part of our built environment action team, we wanted to define food apartheid, which is limited access to affordable, healthy food driven by systemic racism. Next, we have health equity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. Achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. Next slide. So we've got 2 more slides of these. Justice, we define as the process required to move us from an unfair, unequal, or inequitable state to one which is fair, equal, or equitable, depending on the specific content. It's a transformative practice that relies on the entire community to respond to past and current harm. Through justice, we seek a proactive enforcement of policies, practices, and attitudes that produce equitable access, opportunities, treatment, and outcomes. Next, we have liberation. Liberation is the progression toward or the conscious or unconscious state of being in which one can freely exist, think, dream, and thrive in a way which operates outside of traditional systems of oppression. Liberation acknowledges history, but does not bind any person to disparate systems or outcomes. It's a culture of solidarity, respect, and dignity. So we actually had a pretty good conversation with our steering committee about whether or not we wanted to include liberation in our vision or mission. And at the end of the day, we kind of had to do a reality check and acknowledge that we probably aren't quite able to fully embrace liberation, although we would love to get there. It's more aspirational at this point. So ultimately we chose the word thriving for now, but definitely liberation is like more of a long-term vision for us. Next, we have power, which is the ability to name or define, the ability to decide, the ability to set the rules, standard, or policy, ability to change the rules, standard, or policy, and the ability to influence decision makers. So in our mission, we do say that we are seeking to build power within the community because we really do want to kind of shift power from, like city government to actually the people and make sure that we're providing opportunities for really allowing community members to be able to decide and set the rules and policies within the city. Next, we have Public Health 3.0. This emphasizes collaborative engagement and actions that directly affect the social determinants of health and equity. Public health leaders serve as chief health strategists, partnering across multiple sectors and leveraging data and resources to address social, environmental, and economic conditions that affect health and health equity. So this is something that the health department has really embraced and something that's central to our strategic plan and that we're trying to incorporate into all of our divisions across the department. Next slide. All right, next we have social determinants of health, which are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes. Next, we have systemic racism. These are the practices that perpetuate racial disparities, uphold white supremacy, and serve to the detriment and harm of persons of color and keep them in negative cycles. Institutional systemic racism also refers to policies that generate different outcomes. These laws, policies, and practices are not necessarily explicit, but work to create advantages for white people and disadvantages for people of color. And then finally, thriving. Thriving is a dynamic process that goes beyond well-being to include individual and collective growth and grounding in agency. So this is what we've added to our vision, that we really want everyone in Milwaukee to thrive, so that, it's not just that we're healthy, but that we have that collective growth and personal agency. All right, next slide. So we took this framing, and after we developed the updated vision and mission at our last steering committee meeting, we decided on 3 goals that can help to guide the overarching priority of addressing racism and working towards health equity. So goal 1 is getting at income equality. So we want to increase household income, specifically of Black and Hispanic or Latinx residents in Milwaukee. So the 3 objectives the steering committee came up with are to increase job readiness, work on piloting universal basic income, and then increasing living wage. But to do this, we first need to do some studying and research to really define what a living wage would be for Milwaukee. We know that, there's like the Fight for 15 campaign, but we really want to look at it, is that the amount that we should go for, or is there a different amount that people would really need to have a full life in Milwaukee? And also thinking about household size and how that plays into what somebody would need to earn for a living wage. Next slide. The second overarching goal is raising the life expectancy and quality of life for Black Milwaukee residents. We know that there's, I think, roughly a 8 to 10 year gap in life expectancy between Black and white, but we also recognize that white shouldn't always be centered. And so we also want to understand just overall what it would take to raise, sorry, there's something going off. What it would take to raise life expectancy for Black people in particular. We also want to identify a quality of life measurement specific to Milwaukee. We know that there are, some examples out there, but we really wanted to tailor what quality of life measurement would look like within Milwaukee. Next slide. Finally, our third goal for our steering committee is to increase civic engagement and knowledge to participate in local and state level voting. So 2 objectives are to increase voting and voter registration, and then expand knowledge about local and state politics. So if anybody's connected to the county health rankings, they just had a really great webinar yesterday that talked about this. I believe that the one organization that was highlighted is called Healthy People, Healthy Democracy or something like that. But check that out if you're interested in learning more about the connection between civic health and physical well-being. So I think that's all I had to share today. Were there any questions? If not, I'll pass it back to Melissa.
All right, so just before we get to that co-chair voting, I can put myself back on video there. That's just the work that our steering committee is really going to be spearheading, those really foundational equitable practices there that will hopefully help build some of that power in the community. And then that language, I know those terms get used in different contexts, so it's always helpful to make sure that we all know what we mean when we're saying some of those terms. So now we are going to get to our community co-chair voting. I invited folks to, a couple more folks joined the Zoom, so I just invited them to introduce themselves in the chat. If you want to go to the next slide there. So this is just kind of a reminder for everyone for the co-chairs. Our expectations of those co-chairs is that they attend at least 3 of the 4 action team meetings each year. They help us to maintain that anti-racist and equity-focused lens as we work on implementing all of our work here. They will help facilitate these quarterly meetings and then help lead the action team members on implementing the strategies that we've identified. And so the co-chairs should be passionate and knowledgeable about maternal and child health and the Milwaukee community, and also be able to leverage partnerships and have a history of working collaboratively, because this really is that team effort, and we know the health department can't do it alone. So we want to go to the next page there. For voting, we are, right after this, we're gonna get to the co-chair statements for the candidates. And so those will be in the recordings. I'm also going to send a follow-up email with a summary of all of the candidate statements. And then there will be a Google link to do the voting. So you're going to just see the list of each candidate and you're gonna select your top two. And then the two with the most votes, I will just confirm with them that they still have the capacity, and then I will make that announcement. So just pending I need to get some confirmation from folks still, but pending I get that soon, the voting link on that Google form will remain open for 1 week following this meeting. So it's going to close at the end of the day next Thursday. And then assuming I can get in touch with folks, I'll announce those co-chairs on Friday, or as soon as I am able to connect and confirm with them. So these are our co-chair candidates and their respective organizations. And now we are going to get into the statements for those folks. So I will be reading several of these, and then one or two folks will be reading their own statements. So I did not see Johanna Nevin join. Just want to take a little scroll, make sure. So Johanna is with the National Coalition for Healthy Black Families. They're working there as a public ally. Johanna is a white, queer, aspiring doula who is currently serving as a public ally. They have a passion for Milwaukee, birthwork, and liberation. They care about everyone having equitable access to the things needed to not just survive, but thrive, and cares about structural changes happening to make Milwaukee the healthiest county in Wisconsin. Through their education and professional experience, they've developed skills to organize towards achieving common goals with diversity and oppression in mind. And while serving as a public ally with Tanda Thompson, their duties included dispersing information and building a coalition in the community, public and private spheres. So they've worked with local, state government, private entities, and the community. And since racism is a public health crisis, everyone is responsible for the change that we want to see. You want to go to the next candidate. Chris Paterka, I don't believe I saw join either, and I actually do need to confirm that she does still have the capacity to take this on. We just haven't been able to finish connecting in the lead up to this meeting, but I want to make sure everyone has the opportunity to see this full statement. So Chris Paterka is with iCare Humana HMO. Chris is a nurse and mother who has lived and worked in Milwaukee for 30 years and is passionately committed to creating healthy communities. Her nursing career has focused on maternal and child health and has included PNCC coordination, working in a mom-baby hospital unit, teaching labor and delivery classes, and case management of pregnant iCare members. She is currently the population health lead for iCare, which is a Medicaid HMO, and they are piloting a doula program in Milwaukee right now. And she has participated in community coalitions aimed at improving population health. She is on a journey to better understand the privileges that she holds as a cis, financially secure white woman, and is leading the effort of her organization to become NCQA accredited for health equity, which is an accreditation that pushes organizations to reduce health disparities of all types. Tracy, I believe I saw you on, if you would like to pop on and read your statement.
Sure, thank you. My name is Tracy Stanislawski. I've worked at Vision Forward for over 9 years. My passion is working with children and their families. Currently, I had the early education program for children with vision loss and other disabilities. And I also serve on many committees at the state, county, and local levels. I have a master's in social work and teaching certificate and working on my education doctorate in social emotional learning. I believe in meeting all families where they're at by using their unique strengths to empower them to reach their goals they set for themselves. I don't give up on families, instead encourage them to bring their voices to bring change. I feel that I can bring the philosophy to the action team if selected. Thank you.
Next, we've got Akaniel Talmsma of the UWM School of Nursing. Akaniel is interested in serving as co-chair for the MCH Action Team. She's focused on supporting the efforts of the health department in improving maternal and infant health. Her credentials, she's got a PhD, an RN, and an FAAN, and works as faculty at UWM College of Nursing. And her research work focuses on using best evidence, health IT, and community networks to empower the pregnant people and their families and partners during pregnancy, childbirth, and their family life. She's focused on the needs of specific communities and believes that the work of the MCH Action Team is key to further strengthening our communities and our local leaders. She is looking forward to serving as co-chair of Selected and supporting this work through her research efforts as well. Thank you for the opportunity to respond to this call. And then our final candidate is Lakita Watts of TLC Community Health and Essentially Empowered. Lakita is the founder and executive director of Essentially Empowered, Inc., the co-owner and co-manager of TLC Community Health. She's the Southeastern Regional Board Representative for WPHA and is a former Wisconsin Community Health Worker Ambassador for the National Association of Community Health Workers. She has over 8 years of experience in birth work through her community health worker, PNCC, and doula work experiences, and has been working on addressing social determinants of health for much longer than that, supporting families of all backgrounds and cultures. She is a doula trainer, and she developed a trauma-informed care course that is specific to birth workers to ensure that they are inclusive with their patients and clients and ensure that traumatic lived experiences don't get projected onto others. She is interested in serving as a co-chair to bring all of our aligned work together to reduce rates of maternal and infant mortality. So before we get to the next section, I realized that was a lot of me talking at you guys. I just want to say, after reading the personal statements of all of these candidates, I think there is a really exciting diversity in everyone who's interested in the co-chair role. Thank you all for nominating yourselves, and I'm looking forward to seeing who is going to be selected. I think anyone who's chosen, there's just such a breadth of work experience, background, lenses that they can bring. So thank you everyone for nominating yourselves. We are going to get into the main point of this meeting, but I want to give us all a little refresher on the goals and strategies we've already identified for maternal and child health. So our first goal is focused on healthy birth and health outcomes. I realize it's a little small up there. This will be shared out in a follow-up after the meeting as well, so you'll all be able to review it closer. So by 2028, the end of this cycle, we will increase healthy birth outcomes in Milwaukee, especially for BIPOC babies and pregnant and birthing people. And so this one is kind of focused on healthcare systems. And so our first objective is to improve racial disparities in fetal and infant outcomes. Our second objective is to increase access to full spectrum, holistic, and supportive care throughout the pregnancy and the postpartum period. And we've got a handful of strategies identified for each of those, as well as partners already signed on. If you want to go to the next slide, this goal had enough objectives that we need to split them up. The third objective is to improve substance misuse rates and outcomes among pregnant and postpartum birthing people. And the fourth one is to ensure that infants and new parents have their nutrition needs met. So that was all goal one. Goal two, got a little squashed on here, is about reproductive healthcare access. By 2028, we will improve access to high quality reproductive healthcare that is culturally appropriate and offered by diverse providers, with our objectives being to increase coordination between agencies. A second objective being to ensure access to linguistically appropriate and culturally respective reproductive healthcare. And the third one, to safeguard access to the tools and services that are needed to maintain sexual and reproductive health. So this goal is a little bit more patient focused. That's how you can kind of delineate between 1 and 2. Go ahead to the next one. Our third goal is focused on maternal mental health. By 2028, we will improve availability and uptake of behavioral health and support services for pregnant people and caregivers. So the first objective is to improve access to behavioral and mental health services. And the second one is to increase the awareness around the intersection of behavioral and mental health needs with that pregnancy and postpartum period. So go ahead to the next slide. Again, our focus is on taking the strategies that were on there, and don't worry, I've got the individual strategies listed out for you guys. We want to prioritize them, ideally picking out for each of those the top 1 or 2 that we could realistically achieve by the end of the year. We're trying to generate kind of a 120-day plan to bring us to the end of the year, and then start identifying those other strategies if they're going to land in the 2nd to 3rd year range or the 4 to 5 year range. So we're kind of building out our map, our timeline, when we're going to start really picking up on some of these strategies. So if you want to go to the next slide, I might have actually just said everything that is on this slide. That's you know, I'm thinking ahead there. That's why I make these slides, because I know what I'm going to need to say. We are going to use, for the Zoom folks, we're going to use something called Jamboard, which is an online collaboration tool. It's operated through Google, so if anyone's work devices don't like Google, we'll try to have a share screen going as well, so you can see those. And then in person, I've got the giant Post-its. So the Jamboard is basically just like a virtual Post-it board. It's a white screen with little sticky notes that you're able to move around, type new ones, add, subtract, do what you need to do. Just a little Jamboard refresher. There are going to be some left-right arrows at the top. That's how you go through the different slides. We want to kind of think about the feasibility of the listed strategies, move them into a timeline, thinking about that feasibility. What can we get going on now? What's going to be a longer term project? And then we've got pens here. There's a little pen function if you need to annotate things, maybe you want to circle something, whatever it might be there. Let's go ahead to the next slide again. Nope, not yet. Go back. We're going to stay on this screen and actually maybe stop screen sharing for a moment. Let's see here.
You want me to open up the Jamboard?
Yes. Open it. Did I send you the link for that?
Yep, I have it. I just have to put it.
Now, I want folks to be able to talk with each other, but I don't want us in the in-person to create too much background noise for everyone on the Zoom. And I feel like I did this successfully at a previous meeting, but I've just done enough meetings since then that I don't remember how I necessarily pulled that off. I think maybe if you just switch the microphone back to your computer and then mute yourself, everyone on the Zoom should still be able to hear each other. I'll look at the chat and make sure that that works out. That way us in here will all be able to stand up, talk with each other if we want. All the Post-its are on this side. I also just remembered the 4th slide and our 4th Post-it over here is if your organization is working on one of those strategies, what supports do you need? Or maybe no one is identified as working on one of those strategies. What do you think needs to happen to bring that strategy to success? So what supports? Is it promotion? Is it communication? Is it data? Partnerships, whatever it might be. What is needed to make those implementation strategies happen? All right, so in-person folks, go ahead. What time is it? We will do this. Ooh, we've got a couple extra minutes, I think. We've got a little extra time to work on this, so hopefully we won't have to rush conversations. I will try to remember to give a 3-minute warning in about a half hour, so we can try to make sure things move. So I should get that Jamboard link shared in the chat. Again, it should open into a new page for everyone on the Zoom. And again, our big focus is those 1 or 2 things for each goal that we can start doing by the end of the year. All right. So, yeah, maybe switch it. All right. Go ahead and take a look, talk with each other, ask questions. And try to make sure the chat's going okay. If you need some time to read them, absolutely do that first.
I'm curious for anybody who works in the doula space, the 1.2 Medicaid reimbursement for doula care, how realistic is that? And I'm just curious what would be a realistic timeline goal for that one?
Were you guys able to hear that?
It's coming through your laptop, so it's pretty quiet. I was thinking this might be actually where headphones might work for you.
Okay.
That way you can just focus on that. Right. Focus on them.
I upped the volume, so if you ask the question again, they should be able to hear you.
Okay.
Okay, I was just asking about strategy 1.2 Medicaid reimbursement for doula care. And curious like how realistic that is and when that might happen. And it looks like Lakita put in the chat that there's currently a pilot for doula reimbursement.
I believe that was also in Chris Paterka's statement, so. You know, some of these are currently ongoing. I haven't quite thought of how to indicate that. We could maybe add a little note. Ongoing or piloting or something. And then maybe it's a little bit farther down the line for getting it fully implemented for all your Medicaid folks.
Okay.
Because that's not the only one that is already operational. Some of these, our partners are actively doing them. And I thought about color coding. I just didn't think of the best way to indicate that.
When we say
Well,
year,
Melissa, I have a question about that. Would it then be like year one would be evaluating the results of the pilot, and then maybe years, I don't know if it would be years 2 or 3 or years 4 and 5 would be seeking additional funding to scale, or I'm not quite sure. Would it be something related to like scaling the pilot?
That could be, feel free to add some notes. If you look on the left-hand toolbar, there's a little square with a little flap on it. That's a really good idea for how we can kind of categorize what goes on in each year. If you click on that little square, a new post-it note will pop up and you can add some additional notes and comments. Because yeah, those are all really good ideas.
Melissa, year one is when? When does it end?
End of this year.
Oh, so December 2023.
Yeah, so that year one is that 20 day plan.
So are we moving these, Melissa, or we added?
Go right ahead and move them, yep. I gave kind of an idea if I had a thought, but I mostly just don't recall at the beginning, so yeah, move them, stick them, add some notes. Okay. Do what you want to do with them. Yeah. I wonder which two you see.
Zoom group, can I ask you a question? For evidence-based home visitation, what are we saying? Like, is that not occurring now? Are we trying to expand it? What does anybody know what this means? 1.2 exactly?
Yeah, I think that's for the health department empowering families of Milwaukee and DAD programs. And so it would basically just be monitoring existing
just
services.
A little less distracting for each of the two groups. And then you can be listening and report out. And good discussion.
Seems like that could be a year one.
Question you need help with.
I agree. I think continuing monitoring seems like a doable thing to do in the next 3 months. I agree with you, Tracy.
Move it over.
Yeah, does anybody disagree?
Not disagree. So I think that it probably falls in both. I know my organization is also looking to expand the evidence-based home visiting program as well. So home visiting, I know that there are, depending on the models that are used, and the fundings that are based off of those evidence-based models, you know, there are a few current ones, but then there are some that are expanding.
I also know that there's actually in September, so really soon, that I think all of the WIC programs in Milwaukee County, there's 6 of us, and we're having a meeting to basically try to help, you know, refer people into those programs. So there's going to be a big push for that already going on within the next couple of months.
Every way I thought to try to organize that just got more complicated.
And I feel like for Medicaid, anything with Medicaid, it's going to take years, but I also think that we need to move on that quicker, sooner than later. Not having that ability to have that paid for a lot of families really doesn't help their children or themselves.
Are there any like key policy issues that we might be able to pull up and do some collective advocacy around maybe in year 1 or 2 that might help for later?
That's a good idea. Maybe should we make a sticky note for that?
Would it be like identify the policy issues, or like how would you?
I think maybe identify and
arrow and that'll scroll you through
research.
I can tell they are moving stuff around, but just that way too. If anyone's looking at the screen share, they can see the variety. They always add a blank slide at the end.
Okay.
And so,
Two.
Melissa, if you're looking for the name of those PSCs.
Should I create that one?
Yeah, I think that's a great idea.
Yeah. Thank you.
Okay, yeah, we're seeing it now.
They wanted the health department to do that.
Okay. Right.
After presentation, he asked the question, what do you think are the worst outcomes for primary care doctor?
Bailey, I saw your question, and yes, I think that's actually goal 3. So we could probably move on if people wanted to talk about goal 2, and then we could move to goal 3, or if you wanted to start with goal 3, we could jump to that one too.
Is that okay what I wrote on there? Do you guys want to change that before we move on?
Looks good.
Yeah, that sounds great. Thanks, Tracy.
Good. Thank you.
But these kids, and what CXD.
Move on to the second one.
And I just have a question as well. So will these jam boards still be open after this meeting, or when are they closing?
That's a good question.
Are you keeping the jam boards open after the meeting?
Yes, for probably the same amount of time as the voting, so I figure through next week. And they'll be able to keep this link and I'll include it in the follow-up.
Thank you.
The question just came from the Zoom side of things. The jam boards will stay open, so I'll include it in the follow-up email. So if you guys keep having ideas later on, you'll be able to access that jam board. Sorry, continue.
So it's been going on for. And then there's the focus period.
Do we feel ready to move on to the second goal?
For this down here, it's mostly internal.
I think so,
folks,
yeah.
But for you
Yeah.
two external partners, this is if your organization needs support. This is where you put what you need to be successful.
And so in the.
I guess it makes sense that it's mostly internal, but
Only impact on people.
you just had to come out from this side of the building.
Yeah, right.
People with that.
Mhm.
And so then if important things in a healthy environment and been born on the that predisposed to development.
Check on how they're doing over there, but they're a lot of the January stuff too, so.
Yeah. They're on the second page now.
Yes.
Yes. That's they're doing so much.
No, I'm just joking. I just, I started.
We'll let them know that's go. That's feel like we're running out of time here. I know. It's still summer.
I'm curious if anybody on the Zoom has currently adopted a reproductive justice framework. And I'm wondering if we need to add more detail to what are the steps to adopting that framework.
Yeah.
Get support for the Medicare. So what is that? Demonstrate that.
That's a good question. I'm not sure. At the county, we haven't done anything like that. But I was almost wondering, like, in order to like increase coordination between agencies, do we need to figure out some sort of like shared funding source or other resources that will enable us to do that? Or do we believe that kind of exists already? Maybe that's something I can list on there.
I think 2.1, the higher prenatal care coordinators to connect patients to services. Some of that is already going on, so I think that's a continued thing that should start. I mean, in year one.
Okay, so we don't need to put it on there because it's already kind of going on.
It's on there now. I know that there's some expansion, and I know that there's changes going on in that field. So maybe there'll be like an additional hiring, but yeah, it's already going on.
Okay.
Yeah, right.
Next door. And we were gonna do.
No. There's people who postpartum.
Don't get. And most of them.
Yeah.
I see Lakita put in the chat regarding reproductive justice framework through my org. We are currently working on this now. We just received a grant and hours of support to build that out. Cool. I look forward to hearing more, Lakita. And then Mallory said, I believe there will be a spot to indicate what supports are needed. Yep. Yeah. So actually, if you go to the last slide in the Jamboard, you can add in anything that you would need to successfully implement a strategy.
So you can do that right on your everything and within the last 2 years. They took that Allison's blood test. And now they and parents agree with specificity that they can give you allergic reactivity, not just like
Is there anything on this slide that anybody wants to add?
At least allergenic. And actually, if you're not allergic, then so the blood test will become very sophisticated. And maybe that level of sophistication for that blood test could probably be done by the specialist. But just the regular health. And we do to help. That is so managing allergies is not only but if you know what you're allergic to, that's already
On the supports.
and we want to avoid into it, things like that. So
I don't have anything to add to 2, so I don't know if we're moving on to 3.
If that's what you need.
But I love the whole
Or maybe you're like, we don't have capacity.
I'm good to move on
It's
to.
just like, we need staff, so.
Okay. Moving on to
Wow.
3.
Because I was gonna be the one. One of the things we were gonna do. was in less days. Then they have to know how to relate patient, doctor, because one of the reasons that I can get approval. And they will all. And so.
I would say we go.
They-
I'm gonna take all 6 of
and
those.
I-
We don't.
Understanding
And
and the implementation.
This is a hard one, I think, because there's such a lack of providers. Also, I wonder about about how Medicaid supports infant mental health.
Yeah, right.
And then for 3.2, Lakita, your trauma-informed care training, so that's currently also going on, probably needs to be expanded upon or like put out there in the community, but there is a trauma-informed care training for birth workers and those that are in the birthing community through Essentially Empowered.
So Teresina, are you saying that um it training opportunities exist? We're just not sure if it's implemented everywhere or we think it is
Correct.
already. Okay.
So it's not implemented everywhere, and I think a part of it is awareness about the training or lack of awareness. But Lakita does have a trauma-informed care training for birth workers and those in the birth work field. And it's already been, done. And has been utilized not just here, but others like in Dane County and other places are also using that trauma-informed care training for their birth work population as well. So that's definitely something that probably needs to be out there because I think some of it is probably a lack of awareness that that training is there. And then people just not knowing, but so there is stuff. Now there should definitely be more of it. But we do have something that's already started. So I think that can actually be year 1, and then years 2, 3, and beyond is more so expanding that, to make it more across the board.
Saracina, do you know like what might be, so you talked about promotion. Are there any other things that might be preventing like more birth workers locally, like, or I should say like in Milwaukee City from accessing that training that you can think of?
Some of it, yeah, I was gonna say possibly cost. And then like I said, a good part of it is probably just not knowing about the training as well. But for some, especially those that are in the minority, cultures or in the BIPOC communities, cost is a barrier to any training, no matter what it is. So any of these things that involve a training component, we have to be creative when it comes to funding, or how we present those training opportunities and the costs that are associated with those. The same thing even with promoting the workforce or, increase in the workforce. Obviously, like we have to be strategic and think about it costs to train, so how to not just train, but also retain. So, having good retention rates with those trainings and, and improving that workforce. So I also have a perinatal health. So again, with the lack of knowledge, so I have a perinatal health professional training that's kind of a cross between community health work, doula work, and skills training. as like a bridge between or for birth work. So whether they're working in the community or in the hospitals and things like that. So again, there's some stuff out here, but some of it is also just lack of awareness or potential cost barriers as well.
I was almost thinking too, so it's awareness, cost barriers. Oh, sorry about that. Anything else like related to translation? Like would it be meaningful? I was just like I think maybe it was goal 1 or 2 where it talks
That would
about
be
like
definitely
language.
resource. Yes, so resource to potentially like translate some of those training materials or to hire individuals that could translate those materials, and be able to teach it in various cultures. That's definitely, I think, goes across the board for all the trainings, right? Because that's also going to be that's also a barrier. But if we have at least like a few bilingual, or multilingual individuals who are able to take those courses or take those trainings and then kind of like almost like a train the trainer type thing and be able to take it into their communities or be able to be a part of those organizations and those individual courses and things and be able to bring it to those communities. That's what's needed in all of the areas. And I know specifically, like I said, because we talk so much about the BIPOC community, but there are other persons of color that are often left out as well.
Are there specific languages that you've kind of come across being most important?
I know, and Lakita, you can jump in. I only refer to her because we do a lot of stuff together. But I know that in dealing in the community, the Hmong population, there's a large Hmong population. Yep, Spanish Hmong. She said Burmese. Also the Somalian population is one as well that I think, sometimes you have to have a in order to get in. And then also some of the indigenous populations as well, because a lot of times they're close knit and want to be trained, by their own.
Thank you. That's important. I was just asking because I know a couple years ago I got a grant for some Somali Bantu women to help them like track their period, like these types of things. And so I was just curious to see if that was still a need or like what progress had been made. But I did add, and tell me if I got that right, but like maybe recruit bilingual or multilingual birth workers to facilitate some of the trainings. Like, does it matter if it's like a birth worker who would almost be like a TOT, or would you want to have something that was maybe like rooted in like maybe 1 or 2 key organizations that would be responsible for it?
Yeah, well, Lakita put in the chat, should be in birth work. Being in birth work definitely helps because I believe it helps with translating the information, like having a thorough understanding of like what's actually being taught versus, just kind of regurgitating some stuff, but not having like contextual, a contextual way to really map that out. So definitely having someone in birth work, I think both ways could kind of work. Yes, it would be awesome if those training organizations could kind of house those individuals, so to speak, so that way that it can continue to be a thing and not just, oh, this person came, was trained, and then they left, because then we have no way of like tracking, and like seeing how it's continuing or how it's going, or even being able to provide like that full array of like resources and mentorship and support that's going to be needed when it comes to training individuals in those ways, in a meaningful way, in a way that's going to be impactful and also sustaining. I think you're muted.
I was just saying thank you.
So I think that kind of leads to the last slide. I don't know if people are done discussing goal 3, but the last one talks about what support you would need to successfully implement strategies. So translation might be one.
Would you agree that some kind of like funding or grants, if since we were talking about a lot of trainings being cost prohibitive, we need a way to be able to cover that cost for those who need it?
Definitely. I see someone put that in the chat as well before or as you were asking it. Someone put access to legislature. Not just that, but I think having like finding those organizations that already do like lobbying and accessing those that are in public office.
Yeah. So it'd probably be like city, county, and like even like MCW has like a couple like advocacy positions, that we, where we could do some collective advocacy. So I think that's great. We would probably just, I'm sure it exists already, but just like almost like a list of policy like priorities that people could speak to their various elected officials and share with them. So
Also, I think in order to really fully implement a lot of the things that we've talked about, having spaces where the community and the systems, so like the hospitals and like the city, where we are. So whether this is that space and reaching out to make sure that those other individuals are in attendance so that we can fully discuss.
It's a big ask. I gotta figure out what buttons to put in. All right, Zoom folks, can you hear the room again? And then if one of you wants to try talking.
Yes, we can hear.
There you go. You're coming back out of the big speaker. So I don't want to stop the conversation. We still have a couple minutes to finish this up. I just see you guys are on the what supports do you need page. Feel free to be specific here. Like if your organization needs something, feel free to put ABC organization needs promotional support, whatever kind of support. These hypothetical ones are great. If you've got, translation, I saw in the chat, there was some talk around, I believe, the mental health ones. Feel free to add a couple of details like that. So like goal 3 needs these supports, just so that I have a little bit of context around those sticky notes. That's just really helpful for us on the back end as we're bringing all of this together. And then I did add, after I caught up on the chat for you guys there, I added a 5th slide. So if you click over one more, I just added a slide for if your organization is already working on one of these, please feel free to list the program. I think I saw in the chat some of you mentioning that you're working on Lakita. I think you said you're working on the reproductive justice framework, and I think some other folks mentioned some things. So just so I can start keeping track of who is doing what on here, that way if folks need to be connected, someone from MHD wants to work with, your organization, we can start to know who's doing what. This won't count as an official, implementation partner agreement or anything. This is just so we continue knowing who's doing what. That's the goal of this action team. Get us all into the room, see where we can amplify each other. And again, this Jamboard is going to be sent out in the follow-up email, and it'll stay open. So if you keep thinking about it, you'll have next week to come back into it and add some more thoughts. So if you want to just finish up 1 or 2 more minutes, get those last couple thoughts onto those sticky notes. We had mostly internal folks here in person, so just kind of coworkers chatting with each other, as well as a few external partners. Very glad you guys could make it. But even just looking at the chat, I should have put in some headphones because it looks like you guys were having some really interesting discussions on the Zoom. I think I had noticed someone put in the chat that the first year looks like a lot of kind of assessing the current situation. And our built environment team actually had their meeting this morning and realized something kind of similar. The first year was a lot of kind of do that foundational research, assessments, that kind of stuff. And then a lot of the implementation strategies got put into that 2 to 3 year framework. So that might be consistent across all of our action teams, which once you think about it, kind of makes sense. All right. Again, you'll be able to keep typing on that, but we're going to switch back to the PowerPoint. I might actually get a meeting wrapped up on time for once. We're going to be all the way towards the end, some of the last few slides. Next one should be our wrapping up and closing out. So for our future quarterly action team meetings, us internally at the health department, we're still kind of working out what form those are going to take, if they're going to be more like this, kind of talking about the strategies. Maybe we use some of them for some networking time, coordinating our projects and objectives. We've tossed around the idea of bringing in folks to do presentations on policies or potential legislation, things like that. Some folks expressed some interest in technical assistance trainings, or if any of your organizations or programs want to do a presentation to the group, we are happy to have that as well. So there are still lots of different forms that these meetings can take, and they can be collaborative. So if you really want to see one of these things happen, if you've got an idea, if you know someone who does one of those trainings, if it's your organization you want to promote, whatever it might be, please don't hesitate to reach out and let me know, and we can get you on the agenda for, whichever upcoming meeting is the most appropriate. Go ahead to the next slide, please. I want to take just a couple minutes here. If any of the folks on the Zoom or in the physical room here, if any of you have an event, a training, something you want to promote right now, wanted to give just a minute or two for some, give some space to shout yourselves kind of thing, feel free to hop off mute if you want to.
I would actually love to do that. This is Bailey. Can you hear me?
Yes. Yeah.
We have two things. One is part of our maternal child health grant is a community needs assessment around who is serving pregnant and postpartum folks in our area. So I would love to be able to send that link out. Maybe Melissa, I don't know if you can send it to everybody who was on today, but there are a lot of great organizations that we hope to get represented. And again, that's funded through our work with the MCH Title V grant. And then we also have a postpartum OCD support group that we are sponsoring scholarships for. So if anybody is interacting with a birthing person who is experiencing postpartum OCD, that would be a really great opportunity for them. And I can just drop my email in the chat if anyone is interested. Thank you.
I also put my email in the chat, so feel free to email me the flyers or the details or whatever it is, and I will get it included in the follow-up email to send out to the entire group. And Bailey, I made a note to myself to reach out to you to get those details, just to make sure it doesn't slip my mind.
This is Tracy Stanislawski too, and we at Vision Forward are also doing a training on the warning signs of children that have potential vision loss, and then kind of what to do. So we could tailor it for parents or professionals. So we had a pilot through Milwaukee County, which will be ending actually at the end of this month, but we were training some of the daycares in the area on healthy development and what birth to 3 is and how to make a referral. But we also have trainings, again, like in regards to vision loss and just red flags, and then kind of what to do if you have a child with vision loss. So that would be for any of the providers that would need that.
And so are those pre-scheduled out, or are those like on demand where someone can request that you come in and do the training?
We can come in and do the training. We're flexible and can train basically kind of what you need in regards to vision education. So we can tailor that to your group's needs.
Okay. I see Lakita dropped a flyer in the chat there. I'll make sure to download that so that I can share it out. And then in the room, you had something to promote?
Yes, Sarita Bama from I'm Chronically Resilient. I'm going to be doing a workshop that starts up on Monday. It's going to be a 5-week series. It's called Embracing an Anti-Inflammatory Lifestyle. So it's something that can be very beneficial, not only for all of us, but also for parents as well too. So that way they can kind of see how they can incorporate things that can help them just live a healthier lifestyle, as far as for looking at what inflammation actually is and how it affects the body. Also going into nutrition, mind-body connection, movement, and then also building a supportive community. And that will be going every Monday at Calm Integrative Health and Wellness Services. And so I can definitely get a flyer out to you, so that way you can be able to share it with everyone. And then I'm also doing a separate course myself, which will be done virtually through Zoom, which is called the Alleviation Agenda. It's an 8-week intro to holistic pain management. And so it's going through some of the similar aspects, but then it's kind of diving deeper into it. And the goal for that is at the end to have your own personalized pain management program for yourself.
Very cool. Yes, I'm happy to send out all of these flyers. So please send them to me ASAP. I'll try to hold off on sending that follow-up email until I get these, but that means try to send your flyers to me tomorrow. And that way I can make sure to include them. I see the community investment fund link there.
Yeah, so Frederick Hospital has a grant opportunity for nonprofits where they can apply for up to $25,000 to focus in on things that surround health. So like for Frederick Hospital, some of their current focuses are behavioral health, access to health services, equitable access to health services, chronic disease, violence prevention. So if people know any organizations who are doing health work that they think will be great, please share with them.
Excellent. And if you do one more slide, someone already sent me a program that they are promoting. So through Children's, it is a support group for breastfeeding and lactating families, education, board certified lactation consultants to help support folks. It is currently monthly on the 3rd Thursday of the month. The first one was actually this morning. But it was a little late. She told me about it last night. A little late to promote that one, but the schedule is, if you want to close out the chat, it's on the side there. Again, there's a flyer, so I'll be sending that out as well. It is free and you don't have to be a children's patient. They just request that folks register ahead of time just so they can track numbers and who they're serving and everything. And if it is a good program, they hope to expand it. So this is something for any folks you're working with in the breastfeeding or lactation space. And then if you want to do one more slide, I should be remembering right. No, I always forget. There's always one more than I think. Our next steps, again, I will send out a co-chair voting email. It is going to be just about the voting. I'm not going to lump that one in with all the other follow-up information. And that'll stay open for 1 week. Our next meeting is going to be Thursday, November 16th. That one is going to be all virtual. So I'll include the Zoom registration link in the follow-up. And then we do have our CHIP report. It is with our graphics team. They are just finalizing it to get it ready for publishing. And we are translating it. We've got an executive summary that's already translated into Spanish. We're going to get that whole thing into Spanish. And so hopefully we are going to be planning a launch event. And so I will promote that when we have a date selected as well. Thank you so much for everyone. That better be the last one. Go ahead and try next slide again. There we go. Thank you so much, everyone. Again, here is my email address. Please send me these flyers either tonight or tomorrow. I will make sure to include all of these. And that's also an ongoing offer. Anytime you think of those things, anytime you have a new program, a new event, whatever it might be, I'm happy to promote that stuff to the entire action team here. Thank you all for attending, and let's all go ahead and wrap up our day. Thanks so much, everyone.
Thank you. All right.
Good to see you.
See you on the 16th. Sooner something else happens.